Today, I'm going to talk about three key skills that any young budding doctor, pulmonologist, or a physician, or any young doctor who is coming into the field and who needs to set up his own practice and get better so that he can serve and teach more and more patients. Skill number one, it is communication. Now you would wonder that why did I say communication as the number one skill? Because you have been studying for so many years, and whatever knowledge you have gained, you are going to apply it only when you will be communicating with your patient. Either it be communication while you are in the OPD, communication while you are taking bedside rounds, communication while you are seeing patients in the emergency room. Communication is the most important skill for any doctor. As soon as you enter the room, as soon as you meet the patient, as soon as you see the patient, first rule is to greet the patient well. If you greet him, say good morning, good evening, and introduce yourself, you immediately make a connect with your patient so that he becomes at ease and he shares all his problems with you in detail. Don't appear to be in hurry at any time. You should, the patient should feel comfortable so that he gives you the proper history. That way, you will be able to diagnose the correct problem at the correct time and relieve your patient's problems. And also, you will be able to make a connection with your patient. Making a connection is very important so that he feels comfortable, he feels heard, and he feels that you are genuinely there to care for him. The second important skill that all the doctors, especially the young doctors, need to have is critical thinking. You have studied for so many years and you have all your knowledge in your head. Your patient is presenting to you with a particular set of complaints. At that time, it is important to apply the skill of critical thinking to see what his signs and symptoms are and apply them to your knowledge to make the correct diagnosis. If in case you are not able to localize it to any particular system like respiratory system or cardiothoracic system, then you need to ask for more history. And if that is also not gaining you more knowledge, then you need to go for some investigations. At all these steps, applying the skill of critical thinking is the most important skill for any doctor. So, the second important skill is the skill of critical thinking. The third important skill for any doctor, if he wants to serve his patients well and excel in his field, is the skill of collaboration. Most of the time, doctors feel that they can work very well alone. But let me tell you, with my experience of more than 10 years, I have understood one very important skill. It is most important to work with a team. You alone might be the leader of the team or might be the head of the team, but without your team, you are nothing. If you are able to use your nurses well, collaborate with your nurses well, the level of care that you can give to your patients is so much better, and the overall patient experience is very nice. If you are able to work with other specialists, like if I am a pulmonologist, I need to work with physicians, with endocrinologists, with surgeons, with so many people, and my ability, my skill to collaborate with all these individuals is very important so that we can give the correct diagnosis and correct treatment to the patients. Also, collaborating with your juniors. If you are a consultant and you have RMOs who are with you, you have to collaborate with them. Collaborating with technicians like bronchoscopy technicians, PFT technicians, OT technicians is a very, very important skill. So, as the saying goes, if you want to go fast, go alone. But if you want to go long way, go with a team. So, the third most important skill is the skill of collaboration. It is not just about getting better in the medical area or in the knowledge area, it is important to have all these soft skills so that you are able to use your medical knowledge to the optimum level. You are able to use your medical knowledge to get the best results for your patients, because in the end, that is what matters. Nobody cares whether how many degrees you have or how many certifications or specializations you have got. What everybody cares about here is, are you able to put them to use? So stay tuned for more such updates if you are a physician or a young budding doctor or any person who are just entering or starting in the medical field. All the best.